Welcome to our event, Advancing Equity in Health, Improving Access to Primary Care. I'm Katie Mahoney, Vice President of Health Policy here at the U.S. Chamber of Commerce. Access to primary care is essential to leading a long and healthy life. Having a consistent and effective primary care provider is associated with an increased likelihood of receiving preventive care, effectively managing chronic conditions, and reducing mortality. Unfortunately, there are numerous barriers that prevent many Americans from accessing routine quality primary care. As of 2021, the United States Health Resources and Services Administration, HRSA, estimated that 83 million Americans live in a primary care desert or in areas of primary care shortage, where there are more than 10,000 care-seeking individuals per available provider. African Americans are disproportionately affected by this care shortage. Zip codes with a majority African American population are 67% more likely to lack a sufficient number of primary care providers than predominantly white zip codes. As a result, Black and Hispanic Americans are more likely than white Americans to lack a usual source of primary care. Inadequate access to a regular primary care provider can lead to a lifetime of medical problems for both children and adults. Addressing these disparities in access is essential to achieving health equity. I'm glad you've joined us for this important discussion today, highlighting opportunities to improve access to primary care. With private and public sector leaders, we'll discuss the business community's role in addressing disparities in access to primary care, identifying solutions to advance health equity, and improving outcomes among diverse populations. And now I'd like to introduce our first two speakers. We are thrilled to have Dr. Lauren Lyles Stoltz, the Health Legislative Assistant for Congressman Brad Schneider, who represents Illinois' 10th District. Dr. Lyles Stoltz will be speaking with the Chamber's Latricia Boone, Vice President of our Equality of Opportunity Initiative. We look forward to hearing their discussion on the Primary and Virtual Care Affordability Act, which was introduced by Congressman Snyder this October, and the legislative efforts to improve access to primary care in underserved communities.
Thank you, Katie, and thank you all for joining us today. I'm Latricia Boone, Vice President of the Equality of Opportunity Initiative here at the U.S. Chamber of Commerce. In just a moment, we'll be hearing from Dr. Lauren Lyles Stoltz, who serves as the Health Legislative Assistant for Congressman Brad Schneider, representing Illinois' 10th District. Representative Schneider has been a leading advocate for a stronger healthcare system, bringing greater awareness to the importance of increasing primary care access for all Americans. Congressman Snyder introduced the Primary and Virtual Care Affordability Act in October of this year, a bipartisan bill that, among other things, extends through December 2023 the exemption for telehealth services from certain high-deductible health plan rules. I am truly honored to have Dr. Lyles Stoltz join us to share more about this and the work she is doing to advance access to care. Dr. Lyles Stoltz, thank you for taking the time to participate in today's conversation.
Latricia, thank you so much for having me. It's a pleasure to be here.
I'd love to just start out hearing a little bit about your background in this work and what brought you to the space you are in now.
Yeah, thank you so much. I would say the Cliff Notes version is I'm a pharmacist by training. I've really dedicated my career to improving patient care outcomes, focusing on health equity. I started my career really doing a postdoctoral fellowship with Eli Lilly, focusing U.S. international government and regulatory affairs, and then moved to Managed Care Association in Washington, D.C., and most recently was working with the Washington State Department of Health Director for the Board of Pharmacy, and we're working through the COVID pandemic once it hit our borders. And so it's been pretty busy. And I took this role a few months ago now, again, continuing that mission of how do we improve healthcare outcomes? How do we create access, especially in underserved communities? And that's why I'm here, to support the congressman and his great work to achieve this health equity.
Thank you for sharing that. I think it's always important to set the context and the tone, especially because you have been doing this work for some time and have proven that you're not only experienced but you're also passionate in moving this work forward. So I appreciate that. With your extensive background working in healthcare policy, you have experience, as you said, addressing barriers some Americans, particularly in communities that are underserved, face when looking to access high quality, consistent primary care. From your perspective, what are those significant barriers that you've seen? And to that end, what policy solutions should we be considering to increase access to timely, comprehensive, high quality care and services for, again, all Americans, and especially those who have been historically underserved?
Yeah, I think it's the $1 million question in the room, right? It's something that we've all been working toward to identify a sustainable solution for, right? Something that's going to benefit us now and for generations to come. And again, I just want to say I'm so excited and appreciative of having this opportunity to speak on behalf of Congressman Schneider and the great work that he's been doing to advocate for improving health outcomes, access, innovation, and achieving health equity for all Americans. So you first asked about what are those what are those? And I think we've heard this terminology of the social determinants of health are the barriers, whether that's broadband infrastructure issues in rural communities, or even not rural communities, just not directly in the city, transportation issues, health literacy issues. All of these create these barriers to improved healthcare and positive outcomes for patients. So these are things that, from the congressman's perspective, the Primary and Virtual Care Affordability Act is something, one of our efforts, right, to support increasing access by waiving deductibles for patients and for people enrolled in high deductible health plans, so they can access services that is more affordable for them. And so these are some of the barriers. These are some of the solutions that we're working on. The congressman has also held a recent event, co-hosted an event with Secretary Becerra a couple of weeks ago, focusing on vaccine confidence and health equity, and hearing from members in the community to identify what are these barriers so we can continue to shape and modernize our solutions moving forward. So hopefully that gives you some insight to what we're looking at and why we're excited about the Primary and Virtual Care Affordability Act, just again, to create that high quality care environment for patients moving forward.
Yeah, thank you. I really appreciate you digging in a bit deeper on this, and find it so interesting that you not only touched on components of work that we, through our Equality of Opportunity initiative and also through our health policy work here at the Chamber, have been really focused on. But also, we've recently heard about the passage of an infrastructure bill, and I think you touched on so many pieces that connect back to infrastructure and its connection to some of the barriers or the social determinants we hear about. So I appreciate you helping to draw those ties, even maybe you were trying to do that directly or not. But in hearing that and understanding that, why do you believe, you touched on it, but I'd love to hear a little bit more, especially thinking about from the congressman's work, why do you believe it is critical that we as a country really invest in addressing these healthcare disparities?
Yeah, no, thanks again for that question. And I think it's critical because, we have a platform, especially in the congressman's position, and I'm excited to be a part of his team to make these changes for the better, right? Because if we invest now, the whole goal is to lower healthcare costs down the line. We're not creating burdens on our system, but also make sure that we continue to provide high quality care, innovative care for people so they can get what they need for their family, no matter their socioeconomic status. And so it's something that that is something that patients, people, everyone may not identify as a patient, but what people are looking for. And I think if that's the need, we need to help remove those barriers so people can access that outcome of healthcare services. and that safety harbor, that safe harbor for them. And I think, again, like you touched on with the broadband issue and the infrastructure piece, the bipartisan infrastructure package that passed a couple of weeks ago, I mean, 65 billion invested in the broadband infrastructure to help address whether it's a digital divide as one of the barriers that we've seen. And we need to address that issue and address that barrier so patients can have access to lower healthcare costs, improve healthcare outcomes, so people can spend time with their family and friends, and have a higher quality of life. I think that's what everyone's aim is to do, by being healthier, being more autonomous with their care, and being able to live a long, healthy life and spend that with
Right.
family and friends.
Absolutely. And I think, to your point, can only add value to our economy and to us as a country. And so all of these connection points
Agreed.
in the work. In your role serving as the health legislative assistant for Congressman Schneider's office, you've obviously been a key contributor to the Primary and Virtual Care Affordability Act, which was introduced this year, which we've already said is focused on removing barriers to high quality healthcare services. Can you talk a little bit more about this legislation, and particularly how does it address healthcare disparities for vulnerable populations, people of color, and those with limited economic resources?
Yeah, really good question. Again, we've made really great strides in advancing telehealth services during the COVID pandemic. And I think what the lessons that we've learned throughout this experience is, one, how do we make sure that we provide people options to their care so they can get the best care when and wherever they need it. And so this legislation will do just that. It highlights the value of a hybrid approach to patient care, where clinicians are able to provide services both in person and virtually in order to maximize public safety, public health, personalized treatment, and preserve the care continuity moving forward. And I think this is really important of what we're trying to achieve with this work that you just mentioned. And so, how do we waive deductibles or have the option to waive those deductibles for primary care, health services? Again, preserving that primary care piece, but also celebrating and expanding the telehealth piece for people to continue to get access. And so, I think these are the things we're really excited about. We think this is also going to help achieve health equity, which is something that I know the congressman is really excited about it and is really has been front and center on, and continuing to support even Chairman Neal of Ways and Means with their racial equity initiative that we're really excited about. So these are all things that we think can continue to walk toward how do we expand access for people in order to improve healthcare and health outcomes. Did I answer your question?
You did. And I thank you for talking about that and kind of building on the telehealth piece a little bit. I know a key component of the act is the extension of the Carex telehealth provision. Given the huge percentage point increase in telehealth usage in the past year, especially as we think about being in the midst of a global pandemic, could you elaborate on the importance of this particular extension, and how might this expansion of virtual care offerings impact the business community, for example, when we think about the issue of employee absenteeism?
Yeah, no, I'm glad you touched on that. So yes, this bill would extend the CARES Act, the telehealth provision from the CARES Act for 2 years to December 31st of 2023. And again, by providing these services, especially having that flexibility in telehealth, it helps keep the workforce and employees healthier, easier access to the services that they need. So I think that all those factors help mitigate against employees being absent from work and actually feeling better about their healthcare, feeling better about being more productive in their workplace and in their home life. I think that's the entire aim of what we're trying to achieve here, right? Is that whole holistic well-being and healthcare for people so they can bring their best selves to work, right? That I think that can be achieved with continuing to expand this provision to 2023.
Yeah, thank you for that. I think, you really touched on something in talking about the holistic piece, because as we are working with companies, and I have an opportunity to talk to many of our member companies and the work that I do through our Quality of Opportunity initiative. But this past year and a half, almost 2 years, has taught us something about the importance of that holistic piece, and seeing healthcare in many different dimensions, and the importance as we think about our employees and communities that we are both working in, serving in. So thank you for digging in a little
Absolutely.
deeper there. So the U.S. Chamber, I think, you may have heard us say this before, is really committed to engaging the business community in meaningful discussions about healthcare equity, and the role of the public and private sector in bringing solutions to bear to really address race-based opportunity gaps in health. Our Equality of Opportunity initiative is advancing this work in many different ways, and appreciate just having you in this conversation today to help us dig in, as I said, a little bit more deeply, and also bring awareness to and create dialogue around some of these important issues. From your experience, what is the role of the business community in advancing solutions that do increase accessible and equitable primary care? I mean, we talk about it a lot, but you are in many ways on the front lines in this work. And so it's helpful for us to be able to share with our member community, many who are listening to this conversation today, around what are ways that they can take some tangible actions and really be a part of the work that is happening to increase accessible and equitable primary care.
Yeah, I think that's a really good question. So, what advice can we give to those listening on this call? I would say one, provide the education about the plan products that you offer your employees. And even if they're not plan products, but they're additional contracted out health services that promote pro health options and well-being, make sure that it's clear, that those services are clear, and provided to your employee base in a comprehensive and pretty self-explanatory manner, so people can easily find it, find access, learn more if they have questions, whether it's plan related, whether it's prevention related. So I think the more education employers can do around that healthcare package, if you will, for their employment body, we've seen has been a huge issue and concern that I think sometimes we take for granted. But talking about the health equity and why we're here to have this conversation, that making sure that we can have some education around health literacy for people to understand the plans that they're enrolling in. What does that mean for them? Is it the right plan for them? I think those are very important conversations. And then once they have the resources and they're informed, they can make the best decision for them and their family. And so I think these are some of the steps that we can do. And then I also add just listening. Sometimes it's really helpful to listen to your employees and then take that back. So there's this bi-directional communication, because I think we all have our kind of pie in the sky idea of how we're going to make things better. But I think having that two-way street, at least that's what I've seen in my personal experience, as well in this role, the Congressman does a really good job in this, is hearing, or how do we make things better, and then collaborating with people from the private sector and the public sector to continue to work on these sustainable solutions to improving healthcare for everyone.
Yeah, I mean, I'll just note that back to big key things around education and also listening, which are hugely important on many issues that we focus on. But I really do think you're right in terms of thinking about it in this space as employers, being able to educate and equip employees, but also listening and to understand their experiences and where their needs are. So I thank you for that. And I'll just add one last thing around that in terms of, or ask a question in terms of, you talked about collaboration just now. If you can share any opportunities that you see for additional partnership and engagement from the private sector. Again, we have a great audience here that is always looking to go beyond this dialogue to action. And so if you can share ways that you see the private sector maybe already partnering with public sector, or if of opportunities to do so, that would be great for our audience today.
Yeah, no, I think it's a really good question, and I wish I can remember the names verbatim from some of the programs, but I know in our district specifically, we do have some of the life science companies that have partnered with local groups like the American Diabetes Association and have started health equity initiatives with this same focus in mind. And so I out, whether it's to the private sector company or to the association or the nonprofit group, and have a proposal ready and go explore to see what's already out there. There are at least two life science companies I know in our district that have partnered with ADA, like I mentioned, and then there's another association where they're focused on how do we improve access in communities of color. Around diabetes access. And so I think those are happening every day, on the ground level. And I think being able to replicate that both nationally, but also continuing to create those local partnerships are equally as important. And if there are any proposals that anyone wants to come forward to share with us, of course, we're happy to listen. So I think that's my response to that, Latricia.
Yeah, thank you. You heard it here. Congressman Snyder's office is saying, let's, bring forth proposals, bring ideas. We're ready to partner with you. And so I think that's really important. And to your point, there are a lot of great examples across the country of models that are working. And so we would encourage our member network and companies and others who are tuning into this conversation to do a little bit of research, reach out to us, of course, and learn more about what are some of those examples of models that maybe you can plug into or maybe create in a community where you're working and serving. So thank you for lifting that up for us. Well, Dr. Lau Stoltz, I just want to thank you for joining us today for this engaging and informative conversation. I know I've learned a lot, and I just think it was truly an honor to be able to speak with you and hear about the great work that you all are doing on the congressional side of things. And now I'd like to turn it over to our esteemed panel to learn more about solutions for addressing disparities in access to primary care and the role the private sector can play. Thank you.
Thank you for that wonderful conversation. My name is Dr. Anam Parikh. I'm the Chief Medical Advisor at the Bipartisan Policy Center. And I'm really honored now to moderate a discussion with three terrific panelists to continue the dialogue. By background, I previously served in government as Deputy Assistant Secretary of Health from 2008 to 2015. And I'm a board certified internal medicine physician. So primary care is near and dear to my heart. I've always thought that in healthcare, we value better health, better care, lower costs, higher equity, and really primary care services are really the services that get us there. They're really the most important. As Katie earlier mentioned, unfortunately, 83 million Americans live in primary care deserts, and that matters. A recent survey from the Primary Care Collaborative study found that in those counties in America that have strong primary care, public health, and social assets, residents were 42% less likely to die from COVID. So this topic really matters. I applaud the U.S. Chamber of Commerce for focusing on it. Increasing access to reduce disparities vis-a-vis primary care is critical. And we have three terrific panelists who are going to really educate us about the work that they're doing on the front lines to really improve access to primary care and reduce disparities. The three panelists are Nebiu Abebe, Senior Vice President of Social Determinants of Health, Highmark Health; Pope Miller, Senior Vice President, House Calls Clinical Operations at Optum; and Ann Yao, Vice President, Social Responsibility, United Health Group, External Affairs. And so to start, maybe I'll ask each of the three to spend a couple of minutes to introduce themselves, and so we can learn a little bit about their activities. Nebiu?
Thank you very much, and it's a pleasure to join you and the rest of the esteemed panel. As you mentioned, I am the Senior Vice President of Social Determinants of Health for Highmark Health. I've been with the organization now for 9 months, and I'm responsible for enterprise-wide SDOH strategy, overseeing our 4-state geography. Prior to Highmark Health, I was the global head of health and well-being for Sodexo, responsible for the employee health and well-being of Sodexo's 450,000 employees around the globe, and the 100 million consumers that I used to serve around the globe across 5 continents and 67 countries. But most of my work experience has been in public health, advancing public health and population health, and that's the wealth of knowledge that I bring to this discussion. So thank you very much.
Hey, this is Hope Miller. Thank you also for having me today. I am by training a geriatric nurse practitioner, and I lead clinical operations for a United Health Group clinical care program called House Calls. The House Calls program provides annual in-home healthcare visits for Medicare Advantage members, really that will improve outcomes and access to care. The goal of our program is to identify and help close gaps in care and then coordinate care to help close the gaps. So we really have the unique ability to evaluate members in their home environments. We're there for 45 to 60 minutes and often longer. So if you compare that to a typical primary care office visit that lasts a few minutes, we're really able to provide a much more complete and accurate picture of our members' health status. House Calls provides in-home visits in 47 states, and we employ 2,600 advanced practice clinicians, generally nurse practitioners. So during our hour-long visit, we assess social needs, we complete an environmental scan of the home. We have a really robust medication review, which is something that's not typically offered also in a PCP clinic visit, where we look at all the medications that the member is on. And from that, we frequently identify duplication of medications, cost issues, et cetera. We also do a complete health history and physical exam. We conduct some preventative tests and screenings and education. For example, we do diabetes screening. And then we make referrals to support the member's goals and provide actionable education and educational materials for the member. And then just finally, following the visit, we send a summary of the findings from the visit to the primary care provider of the member, and where we will identify if there's any risks or concerns that we found during the visit. And then if the member does not have a primary care provider, we help find them one. And then we also send the same summary to the member so that they can have that information to empower them as well when they meet with their PCP.
Great, and I'll close things out. My name is Ann Yao. As part of United Health Group's social responsibility organization, I lead several social responsibility and philanthropic efforts on behalf of United Health Group. I've been with the company for approximately 11 years. Excited to be here today and to talk a little bit more about this really important topic. Just a bit more about what I do and what United Health Group does, particularly in the social responsibility realm. You know, we're a team of 340,000 people, and our mission is to help people live healthier lives and help the healthcare system work better for everyone. We do that by improving healthcare access, affordability, and experiences and outcomes. Through our businesses, which include Optum, as well as United Healthcare, as well as our foundations, we're really focused on advancing health equity through business-related activities, social responsibility, and philanthropic efforts. We have hundreds of programs underway to do just that, with a particular focus on expanding a more diverse health workforce, increasing access to care, addressing social determinants of health, and really in working to improve the health of pregnant people and their infants. We're really proud of the progress that we've made in advancing health equity, but we have a long way to go. We recognize that. Recently, the United Health Foundation, which is the philanthropic arm of United Health Group, released a new America's Health Rankings report focused on health disparities exclusively, really measuring the breadth, depth, and persistence of disparities in population health over time and across several different lines by race and ethnicity, by gender, by educational level, geographic. It's really eye-opening about what this report shows. And it certainly guides our social responsibility efforts as well as our business initiatives. And it certainly shows the importance of focusing on addressing disparities in access to primary care.
Wonderful introductions. Well, let's drill down into the specifics of how all of you and each of you are addressing disparities when it comes to access to primary care. Hope, I think about your house calls program, and what I hear is really an extension of primary care for seniors in the home, and it's so important for so many reasons. I think about falls, the leading cause of injury-related death for seniors, costing the Medicare program, for example, $36 billion a year, almost as much as it costs cancer. The work that you're doing sounds so important in increasing access, particularly for that group. If you could talk a little bit about how you reduce disparities, increase access, and your efforts. I understand recently the United Health Foundation announced a grant to National Children's Hospital to improve access to healthcare for underserved children in Washington, D.C. I mean, that's sort of primary care for underserved children. And certainly, Nebayu at Highmark Health, you all are focused on primary care as a linchpin. If the three of you can maybe just talk a little bit more specifically how your efforts are addressing disparities in access to primary care. And maybe Hope, we'll start with you, and then Ann, and then Nebayu.
Okay, great. Thank you. House calls absolutely represents the opportunity to increase access to care for underserved members by meeting them in their homes. We started a travel program a couple of years ago where I have nurse practitioners, over 300, who travel. Their full-time job is to travel to rural areas across all states. So especially in a lot of rural areas with nurse practitioner shortages. So we have these dedicated APCs that will go over every state is covered, so that we're in. So we completed over 270,000 visits this year in 1,300 rural counties. And actually a third of our total visits are in counties of low socioeconomic status. We complete a social determinants of health assessment for every single member. So as most people know, this evaluates members for social barriers to health, including food insecurity, transportation that may impact their ability to access health. And so when we identify needs during the assessment, we connect members with community-based organizations to help close the gaps. This year, we've made over 275,000 referrals to help support our members. The top referral reasons are really low income and transportation needs, as well as medication affordability and food insecurity. We have a team of care advocates that are going to help find the member a PCP if they don't have one, help schedule appointments, and find specialists. I'd like to quickly share a story that really underscores the impact of our program. We had a nurse practitioner who visited a member who had a history of stroke and heart attack. He told our provider that he lives on $700 a month and does not have extra money to pay for prescriptions, copays, utilities, or food. He'd lost his Medicaid and was not able to read the application to fill out a new one. So because he couldn't afford the copay, he hadn't seen his cardiologist in over a year. The day our provider saw him, his blood pressure was really elevated. So our nurse practitioner called our dedicated advocate for Me-Line. It's a UHG program that matches members to help find personalized solutions. And they were able to help him reapply for Medicaid, get assistance with food, and connect him with a medication assistance program. And then our provider also called the member's cardiologist during the visit and let him know the situation, that he didn't have funds for the copay. And they agreed to waive the copay, and she made an appointment for him for the next day.
That's great. Terrific example. Ann?
Sure thing. Now, happy to talk a little bit more about our partnership with Children's National Hospital. We're really excited about this, and this is really part of our such a great example of how we are working to increase access to care and really get upstream as much as we can in addressing health needs, both from a physical perspective, a behavioral health perspective, early in life, and knowing how critical that is for someone to have not just a healthy childhood, but to move into a healthy adulthood as well. The data certainly credential the importance of doing this and the risks that children face We see through the America's Health Rankings platform that I mentioned earlier, increases in teen suicide, increases in childhood anxiety. From a behavioral health standpoint, we see incidents, an increasing incidence of asthma, and certainly significant disparities around children getting the preventive services that they need. So we're super excited about this partnership with Children's Hospital and the opportunity it provides to reduce disparities for school-aged children in Washington, D.C., particularly in wards 7 and 8, which for those of us who don't live in the district are some of the city's most underserved neighborhoods. What this 3-year partnership is doing is bringing together a really unique team of school nurses employed by Children's National, as well as community health workers, to reach kids and families who aren't currently being seen by health providers. And a really good marker of this is school absenteeism. That's an important tell. This unique team identifies kids and connects them to care, either through mobile health, through children's own clinics that are located throughout the city, or can also connect children to specialists through telemedicine. And so the goal of this is to really reduce absenteeism among students and make sure kids are getting the right preventive services they need. Think vaccinations, think well child visits, developmental screenings. And we're tracking school attendance data, we're tracking immunizations records and health records to know that we're on the right track in reaching at-risk children and really closing these gaps to care that exist in these underserved neighborhoods for a long time.
Great, terrific. Nevaeh?
Wow, those are 2 great examples. I'd like to share one example for Highmark Health. We know that many people don't access primary care because they just don't trust doctors, they don't trust the healthcare system. And so with that in mind, one new innovative community health initiative that I'll be sharing today is called Thrive 18. And Thrive 18 is a collaborative effort where we have formed a strategic partnership with a community-based organization called Project Destiny, who is the trusted community entity that we're working with, who has hired community health workers who are individuals from the community who are directly engaging households and individuals within 3 zip codes on the north side of Pittsburgh. And so we're hyper targeting this program to reach the most vulnerable segments of the community within that side of Pittsburgh. And what these community health workers do is they don't wait for, we're not trying to wait for individuals to come access the healthcare system when they have a crisis, but we want to be able to proactively engage them in their health and well-being. And so these community health workers play a pivotal role in building trust with the healthcare system through this community-based organization partnership that we have. And so to date, they've canvassed over 5,000 households, and they also administer a social determinants of health assessment. And so we collect lots of data on the individuals, and those who are flagged with social risk are then connected to local care and resources. And we use our community support platform powered by Aunt Bertha to make those connections. And to date, we've seen very promising early results with respect to reductions in total cost of care, ED visits, and overall quality of life improvement.
That's wonderful. Just terrific examples all around. I want to ask all 3 of you, and maybe, Anne, we can start with you. Employers and businesses, how do you work, or how do you engage employers and businesses in your efforts? And what message do you have to employers and businesses in what they can do to try to address disparities in access to primary care?
Sure thing. Well, I think the reason why we're talking here today shows that if this was one sector's issue to solve, we it would have been solved by now. These are thorny issues. It's complicated, and partnership is key. When I think about what employers in the business community can do, I think it all starts with aligning on wanting to make a community healthier, and I think that is a shared goal. What sometimes can be challenging is figure out how to work together. And what I would suggest, and I think we've seen not just from United Health Group's own experience, but certainly those of others around building relationships and building trusting relationships around shared objectives. We've certainly have seen this in bringing together local government, the business community, the nonprofit sector in communities across the country to address some community-specific health challenges and to work together on where there are, what the problems are, identify the solutions and then implement them and watch them and refine them over time. And so I think we just need to break out of our silos a little bit and be willing to work together in some maybe somewhat unorthodox ways to really achieve shared goals, because I do believe that we have them, because we know that having a healthier community isn't good for anyone, it's good for everyone. And that's something that we can really lean into as we go forward.
Terrific. Hope?
Yeah, I would say, increasing access to primary care and improving the health and how house calls impacts that. Really, the goal of our program is to provide access to healthcare. And we talked about identifying gaps. We completed, I don't think I said this before, we completed almost 1.7 million in-home visits last year, and we've already completed 2 million this year. So our impact is really broad. If the nurse practitioner identifies an urgent need with the member, for example, really high blood pressure or an eviction notice, we have a team of nurse care managers and social workers who will follow up with the member within 24 hours after the visit to ensure they were able to get connected with the PCP or the needed services. We actually identified and helped over 140,000 members this year with those type of urgent or emergent needs. We also refer members to more longitudinal care programs, including heart failure programs, and we've talked a bit about behavioral health, which is quite an issue. So we can connect members to behavioral health programs and providers as well. And I'm always going to give a story if I get an opportunity because we have such good ones. We have a practitioner who'd been seeing a member for several years, and she was doing her annual visit with him this year and just noticed that something was off. He was complaining of shortness of breath and fatigue, and he had made an appointment with his pulmonologist. And after examining him, the practitioner was really concerned that this was more of a cardiovascular issue rather than pulmonology. So she called the member's doctor and said that she really thinks he needs an urgent appointment with his cardiologist. During the follow-up call, the member let us know that when he met with his cardiologist, he ended up having a positive stress test and a follow-up angiogram with over 95% blockage. And they weren't able to place stents, so he ended up having open heart surgery. So he said he really did not think he would be here today if it was not for his house calls visit.
It's another great story. Thank you. Nabil?
Yeah, a really good, important question. In my previous role at Sodexo, I had an opportunity to consult and advise many of our clients, many of whom are Fortune 500 companies, and work very closely with their chief medical officers and heads of HR. And I have to tell you that, they're beginning to take an SDOH approach to their employee health and well-being programs. And one piece of advice would be to integrate an SDOH assessment into their employee health and well-being programs. So to date, they are assessing their employees, but they're not really truly understanding the root causes that are driving poor health and poor health outcomes. And so by integrating an SDOH assessment, that allows them to really identify those issues, whether it's food insecurity, transportation issues, they might be suffering from intimate partner violence, and allows them to really address those root causes, right, to help them improve their quality of life. And from a DE&I perspective, taking a DE&I lens allows to really tailor interventions to meet the unique needs of diverse populations. And so that's how we're working closely with some of our clients over at Highmark is to really help them first identify the needs, to really understand the full picture of their employees and their family members. And then once you have that basis of understanding, then you can develop those employee-centric interventions that can really help move the needle. So we are designing solutions informed by this type of data and measuring the impact of those programs and then continuously innovating on those solutions.
Wonderful. Well, we have about 5 minutes left. So one final question, and Nebayu, maybe we'll start with you. When we think about this topic of addressing disparities in access to care, what makes you hopeful that we're making progress? Or is there some one change, it could be a policy change or some other change that you think we really need to sort of catalyze progress in this area? And maybe again, Nebayu, we'll start with you, and then Anne, and then Hope.
Sure, thanks for the question. Well, I'm hopeful. Unfortunately, due to the tragic loss of George Floyd, there's been a lot more focus in investment from businesses and the healthcare community around the country. So that's one aspect. Another aspect is I'm hopeful that more and more organizations are leveraging data to gain key insights that would allow for a more patient-centered approach. And there's also a broader focus on well-being and not just physical health, but the integration of physical, mental, and social health to deliver whole person care. And so that's what I'm hopeful about, and that's the focus at Highmark Health. And that's really the focus of our Living Health business strategy. It's the integration of physical, mental, and social health to provide whole person care for our members and patients.
Terrific.
Great. Well, it's a good question to end on a hopeful note. But I'm going to wear my philanthropic hat for a moment. And when I think about in my role, oftentimes we're focused on closing gaps in care and addressing access issues with people who, for one reason or another, are not getting the care they need. And these communities are everywhere. They're in tribal communities, in rural communities, in cities. But a common tie that binds is oftentimes historically, I think, we haven't, the healthcare system hasn't done enough to meet people where they are. And I'm hopeful because I really see that changing. I see that rather than the healthcare system asking people who don't have transportation to come to a doctor's office, rather than always using language that people don't understand, really seeing changes in modernizing care delivery through different care platforms such as house calls that Hope has spoken about, through virtual visits, through mobile care delivery options, to really meet people on their terms. And I think that's tremendously important. I think we've seen a real jumpstart of that as a result of the pandemic in reimagining care delivery, making things like telehealth much more accessible. And I think with that, not just bringing people access to care, I'm hopeful that we're becoming more sensitive on how care is delivered and making sure that the experience that people receive, the care experience, is one that reflects their backgrounds, their unique circumstances, their culture. And I think the focus on investing in a health workforce that really reflects society, our focus on understanding people's whole selves and all that they bring to a healthcare experience is something that is inspiring to me. I know we have more work to do, and I think that's really something we should carry forward into 2022 and beyond.
Wonderful.
And, I'm just going to echo what my colleagues have said. I think I'm hopeful that there's clearly a much bigger focus in the healthcare landscape on SDOH needs and then helping members and being able to really see outcomes on that. We've all talked about that, and that's hopeful to me, as well as the focus on behavioral health, especially during our continued COVID pandemic. And then again, Anne talked about this, our ability to offer other ways to connect with members, especially those who have healthcare access. So we actually, during the beginning of COVID, we stopped doing house calls for about 3 months. But quickly, in 11 days, we were able to stand up a virtual visit program so that we were able to access or provide access to members who were sheltering in place or couldn't get out. So I think, a continued focus, that's definitely happening, continued focus on being able to offer, being creative and be able to offer different modalities to help people get access to healthcare.
Wonderful. Well, I want to thank all three of you for your insights, your leadership. Thanks to the Chamber for convening us. I can't think of any more important policy issue than this on the health side, other than to address disparities in access to primary care, which I think is absolutely vital to improve health outcomes and reduce preventable healthcare costs in this country. So thanks to the three of you. And now we'll move to the closing for today's program.
On behalf of the U.S. Chamber of Commerce, I want to thank our speakers, moderators, and contributors for being part of this very important and impactful conversation today. We appreciate your insights, collaboration, and leadership. There's no doubt that there's much more work to be done, but we are proud of the progress we've been able to make and inspired by where we're going together. Today's event is a reminder that we can drive meaningful change through public policy and private sector solutions. For our Chamber members who joined today's discussion, I invite you to become an active member in our EOI Health Task Force to continue the conversation on how the business community can address disparities in access to primary care. We know that realizing true equality of opportunity requires many voices and perspectives, and a long-term commitment that goes beyond today's dialogue. For more information on our work and how you can get involved, please visit us online at uschamber.com. Thank you for joining us today.